what you said, it made me both of you talk about this. You said that the Affordable Health Care Act is based on restricting expanding, which runs counter to what the Obama administration message is, that we're ensuring more people with pre-existing conditions. We're going to insure 40 million more people. That means they'll go into these, they'll have doctors, they're going to healthcare exchanges, and they won't have to go to emergency rooms where the care is much more expensive. So how do you reconcile
what they're going to do is they're going to add another 16 to 20 million people to Medicaid, which is a broken system. Many physicians can't afford to take Medicaid. Some will even see Medicaid patients for free because it costs more to deal with the bureaucracy of getting paid by Medicaid and putting yourself at risk for being told you're committed fraud because you made a billing error. So to put people into Medicaid is going to give them meaningless coverage instead of meaningful access. So that's part of the problem. And by opening up these exchanges, again, the exchanges are there in order to subsidize people. So you're increasing the amount of money that the government is going to have to be paying, the taxpayers are going to have to be paying. Somebody has to put the brakes on spending. There's limited resources, so we have to limit how those are used. Who gets to do it? Is it going to be an unelected small group of experts in Washington? Or is it going to be the patient and the doctor looking at what kind of treatment is necessary, what are their personal resources, what's available from people voluntarily? Who makes those decisions? Somebody has to put the brakes on. It's a question of who gets to do that. And the government can't keep spending the way it's been.
One of the ways I think we can make Medicaid more cost efficient and work better for citizens is through block granting it to the states. This is part of my 10-point plan, is to block grant Medicaid. I think state legislatures and the governors of our country will more efficiently run Medicaid dollars if they're block granted rather than having it run how it does currently. This is something that's been talked about for a long time in Washington. It's never come to fruition, but I think with the Affordable Health Care Act now relatively new, it's a good time to talk about block granting Medicaid. May be difficult with the Affordable Health Care Act on the table, but if I'm the 51st voter, one of the votes to repeal it, I'm confident that we can also block grant Medicaid. And frankly, I trust state legislatures and state governments more than I do the federal government to run Medicaid in a more efficient fashion. Today, 1 in every 4 kids in Ohio is in poverty. That's unacceptable, and obviously these kids are receiving their health care through Medicaid, and so the more efficient that Medicaid program can be run, the better it will be for our state and country. One thing I did not mention earlier that I should mention is Senator Brown, who we're running against. He was one of a handful of people who actually voted for Obamacare but said it didn't go far enough. He was advocating for a system that went even farther, that had even more government control. And I believe that's an illustration of extremism. While I fundamentally disagree with the Affordable Health Care Act, with Obamacare as it passed, to have a senator from Ohio actually say we should have gone further, it didn't go far enough, I believe is just out of touch with mainstream Ohio.